Healthcare access in America, a fundamental right that most developed nations take for granted. But in Idaho, a new bill threatens to turn that assumption completely upside down.
You know what's fascinating about this situation? House Bill 345 could reshape healthcare access for nearly a quarter of Idaho's population. That's over 400,000 people who depend on Medicaid.
Let me paint a picture of what we're looking at here. This bill would give legislators unprecedented power to make sweeping changes to Medicaid coverage, bypassing medical experts and established healthcare protocols.
That's particularly concerning when you consider the data from similar attempts in other states. Montana's experiment with restrictions led to a 15% drop in preventive care visits.
And here's what really gets me: the speed at which this is moving through the legislature. We're talking about changes that could affect generations, being pushed through with minimal public input.
Hmm. It reminds me of what happened in Kansas back in 2019. Their rushed Medicaid changes led to a 23% increase in emergency room visits within just 6 months.
Well, that's exactly why the timing of tomorrow's Senate Health and Welfare Committee hearing is so crucial. I was talking to an nurse in Idaho Falls who's already seeing patients rationing insulin.
Oh, wow. That must be devastating to witness. What other impacts are healthcare workers seeing on the front lines?
So get this: hospitals in rural areas like Salmon and Sandpoint are reporting that some patients are driving up to 4 hours just to see specialists. Any cuts to Medicaid could make that situation even worse.
And these aren't just isolated cases. The data shows that when states restrict Medicaid coverage, emergency room visits increase by an average of 20%.
You know what's particularly striking? The contrast between Idaho and neighboring states. Washington and Oregon have actually expanded their Medicaid services, leading to better health outcomes and, believe it or not, lower overall healthcare costs.
That's quite a stark difference in approaches.
And here's another layer to consider: the economic impact. Studies show that every dollar spent on preventive care through Medicaid saves about $3.50 in emergency care costs down the line.
Well, that certainly challenges the argument that these restrictions would save money.
Let me share something that really puts this in perspective. Last month, I spoke with a family in Boise, both parents working full-time jobs, two kids with chronic conditions. Without Medicaid, their medical bills would exceed their annual income.
That's the kind of story that really brings home the human impact of these policy decisions.
And you know what's interesting? The public response has been overwhelming. Community organizations report that their phones are ringing off the hook, with people asking how they can get involved.
So, what are the most effective ways for people to make their voices heard on this?
Well, the data shows that personal phone calls to representatives have about 10 times the impact of form emails. And testimony at public hearings, that can completely change the trajectory of legislation.
These grassroots efforts seem to be gaining momentum across the state.
Right. And it's not just in urban areas. We're seeing unprecedented organizing in rural communities where healthcare access is already limited. People understand what's at stake.
The ripple effects could extend far beyond Idaho's borders.
Exactly. If this bill passes, it could set a precedent for other states looking to restrict healthcare access. We've seen this pattern before with other healthcare policies.
That really puts tomorrow's hearing in perspective.
And here's what people need to understand. Once these kinds of restrictions are in place, they're incredibly difficult to reverse. We're talking about changes that could affect healthcare access for decades.
The stakes couldn't be higher for Idaho's future.
You know what this all comes down to? Whether we believe healthcare is a fundamental right or a privilege. That's the real question at the heart of this debate.
And tomorrow's hearing could be the turning point.
Let's hope the voices of those 400,000 Idahoans who depend on Medicaid are heard loud and clear. Their future health quite literally depends on it.